Okay, we'll check in with you in just a few minutes. In the meantime, a new light therapy is giving hope and relief to chronic pain sufferers, the likes of which they've never seen before, delivering a 50% reduction in pain.
And the technology that's helping fibromyalgia patients was developed right here in Northeast Ohio. Jen Pachano shows us how this laser technology works.
I mean, a lot of people describe it as being either having the flu and falling down the stairs, or some people say they feel like they got hit by a truck.
Donna Penner has been suffering from chronic pain for more than 2 decades.
It changes every day. It changes where the pain is. It changes the severity of the pain.
When she described her symptoms, a doctor quickly diagnosed her with fibromyalgia.
He proceeded to prescribe various medications for me, none of which helped.
In our mind, there was a lot of misdiagnosis of fibromyalgia, and there was also a lot of concern in terms of patients just being prescribed medications. And the medications weren't always even meant for fibro. It's just that they affected some relief in about 10 to 25% of the patients.
Tom Kelly, global president of Multi-Radiance Medical in Solon, says their laser therapy technology was first FDA approved for pain management and accelerated healing.
We've done very well in the sports medicine market, where we probably have over 200 and some lasers in major professional sports teams as well as major colleges. In fact, most of the pro sports champions have all used our lasers.
Dr. Timothy Demchak is an athletic trainer who was using multi-radiance laser treatment in his clinic when he had an idea.
And I had a patient come with fibromyalgia, and we started new laser work with pain or decreasing pain, so we tried it on her, and she had a huge decrease in pain, and tender points started dropping off, and her activity levels started going up. Like, this is really cool.
He had more fibromyalgia patients come in who experienced similar successes in reducing tender points and pain levels significantly. That kicked off a decade of research and several case studies that were equally encouraging, followed by FDA approval for the FibroLux. How does it work on the pain?
What the lights do mean is it's causing vasodilation or increasing blood flow to the area, and also inhibiting those nerves from sending a signal to the brain.
The patients don't feel a thing during treatment, but the results and the relief can be instant.
Their pain decreases almost immediately. So they'll tell me they have a pain level of like an 8 out of 10 at their tender spot, and when we're done, it has dropped to a 4.
Wow.
So again, we talk about 14 tender spots, and that's all dropping. They're like, wow.
During a 3-week clinical study, patients got 9 treatments, 2 minutes on each tender point, after which they reported a little over a 50% decrease in pain and 50% decrease in tender points. Those in the study who added exercise saw even greater positive effects, a 70% decrease in pain and almost an 80% decrease in tender points.
Most of them just stopped their medications because they didn't need them anymore.
The intense decrease in pain is allowing these fibromyalgia patients to finally be active again.
What we found is it's a combination of both laser reducing pain and the ability to exercise that is really beneficial.
I have absolutely, and I'm a skeptic, I have to tell you, I have absolutely noticed that the pain and the tenderness is much less.
Donna is ready to get moving again with much less pain.
When you feel better, you do more. So I'm really excited about this, and for everyone else that has fibromyalgia, because up until this, honestly, there's nothing out there to relieve the discomfort.
Jen Pachano, 19 News.
Now, the price of FibroLux sessions will depend on where you go to get the treatment, and insurance reimbursement is still a question mark.
But as long as the light therapy has been prescribed, it can be done at a clinic or office visit at most physicians, chiropractors, athletic trainer, or physical therapists.
Now your 19 first.